When we say flexion, this is flexion, or that is trunk flexion, okay? Extension, neck back, or even the spine back. That's spinal, and then that's neck extension. Now, you have to notice when we talk about lateral flexion, but you have to designate which side. If I would do this, think about it, it's me, that's lateral flexion.
Would that be left?
The left, yes. Rotation, to the right. Rotation left, okay? And then circumduction. It's not technically circumduction, but it's when you're moving in all the motions and planes. I'm actually lateral flexion, a little rotation, flexion. You're throwing all the movements into one. So that's neck and trunk. If anybody has questions, please stop me. Shoulder girdle, we just demonstrated those. We have elevation, and then we have depression. We have protraction. Okay, then we have retraction. All right? And then with the scapula, what is it? What would this one be?
Upward.
Horizontal abduction.
No, well, I'm coming from here to here.
It's just upward.
This is shoulder girdle.
Oh,
Upward
rotation.
rotation.
Upward rotation. And of the scapula or shoulder girdle, that is what?
Downward.
Downward rotation. Think about inside there, that scapula rotating up and then down, all right? Upward, downward rotation. Now with the shoulder, we've got flexion, extension. And what do we have next? Abduction, and then adduction. Then we have, starting here,
Inner.
internal or medial. Either one would be fine. You will find when you guys get on clinicals that you'll have people that use both. And that is
External.
lateral, external. And you've got circumduction. Okay, here you go now. What is this one?
Horizontal adduction.
Adduction, it's closer to midline. Horizontal adduction. Don't forget to put the horizontal in when you do this on a cuff. Because see where these all will come in to play? When you're writing your notes, you're writing, had patient perform horizontal adduction, or had patient perform shoulder flexion. Right then and there, I know what you had them do. You're giving a description. You didn't say how to move their arm. That tells you nothing, doesn't it? All right, elbow. Elbow has two, guys.
Wait, what is scaption?
Oh, scaption, sorry. That's, if you start here, and you'll learn the degrees, we come forward about 40 degrees. That is the motion here. It's not all the way in abduction. It's not a deflection. This is actually the more natural, comfortable movement for your shoulder and shoulder girdle. It's a position where the scapula glides along the rib cage easier. So when you hear somebody say they moved and did scaption, they didn't have them here or here. They had them about 40 degrees forward of abduction, okay? That's scaption. And I probably won't ask you scaption on the confidence. This purpose is to get the basic movements, the basic directions down for each of the joints for you guys. Elbow, flexion, extension, that's all you got. Flexion, okay? Extension. All right, wrist. Remember, start anatomical position, wrist, flexion. Wrist, extension. Okay, and then people that can go past that, you're getting into hyperextension then. That's hyperextension. So, flexion, extension, and then hyperextension when you go even farther. What do we say this one is? Radial. Think about the bones. Think about your radial pulse. All right? And then ulnar deviation, and then you can do circumduction with your wrist. Now your radial ulnar joint, both of these bones here, they actually will cross over. They cross each other. That's why you get so far and you stop. But we have, what do we say it is when you do this?
Supination.
Supination, you hold the sup. And then pronation, okay? Supination, pronation, all right? Everybody okay so far? All right, now we're gonna start talking about the finger joints. because you guys will learn these in bony prominences. These are your metacarpals, the long bones of your hand, all right? All your long fingers are called the phalanges or phalanxes. So at this joint here, this is 2, 3, 4, and 5. This is digit 1. We have flexion and extension, all right? And we have ab and adduction, all right? Flexion, extension, ab, adduction, all right? Now, we get to the next one. Think about it. This joint is what to that joint?
Wait, can you do that again?
This joint here is distal to what, or is
It's proximal.
proximal to that joint.
Mhm.
So this is our proximal interphalangeal joint. These are called phalanges. So this is the proximal. So this is gonna be the what?
Distal.
So distal interphalangeal. So you hear them called PIP or DIP. It's fine either way. So at those joints there, you just have flexion and extension. Flexion and extension.
Oh.
And at your distal one, I can't do all of
Kind
them
of
that
hard to
way.
do one without the other.
I mean, you could do
Oh.
flexion and extension, flexion, and some people have and that involves other muscles that we'll learn later on.
Yeah.
All right. Now, carpal metacarpals between the wrist and the metacarpals, there's not really much movement. That's your wrist bones, the small little wrist bones here. There's not much discernible movement in there, okay? Now, carpal metacarpal 1, that's right here, this joint there. That's where the base of your thumb meets the carpal bones in your wrist, okay? We've got multiple movements. We've got flexion, comes across. Extension, it comes out. This is your one exception, guys, for abduction and flexion extension. That's extension, all right? Abduction, this is a hard one. This is kind of the dog's mouth here. You start and yours comes out away from the palm of your hand. It's a hard movement to do unless you practice
It's
it.
like up then, if you're like.
It's like if I'm in anatomical position, it's coming straight forward.
Oh.
That's abduction. This is extension, and that's flexion. This is abduction, and then that's adduction back, okay? That's the one to remember. This is abduction. This is adduction, okay? That's your exception. We always said abduction movements are in the frontal plane. This is the exception, okay? And then what do we say this is?
Opposition.
Opposition, and then we go back to the neutral point,
That's
reposition. There we go. I know it seems like a lot, but once you guys get to practice, it won't be that bad, honestly. Metacarpal phalangeal number 1. So we're talking about metacarpal phalangeal right here on digit 1. Because we always count from the thumb. 1, 2, 3, 4, 5. We only have flexion and extension. That's it. Flexion, extension. And on the comp, if it's one of these, because can you tell which joint I'm moving here? I will say this right here, what's this joint doing? We will point it out to you. I'm not gonna make you guess what I'm doing. Because it's hard to separate when we get used to doing functional movements with a hand. You know, trying to do that, I will say, what is this? So there's no confusion, so don't worry. Okay, hip, guys. We have similar motions with the hip. What would this would be? Flexion. And then what is this? And even if we went back, we can get a little farther. What do we have when we go away from midline? Abduction. And when I come back?
Adduction.
Abduction. Then we've got, okay,
Internal
hip
rotation.
internal rotation, and
External
there you
rotation.
go. And then circumduction, okay? All right, now, knee. The basic ones, this is anatomical position, correct? So now, joint angle gets smaller and it's moved upwards, so that's knee flexion. When I come back, that's extension, all right? Now, with this, there is slight movement of the tibia. Everybody knows the tibia, your shin bone, all right? When you flex your tibia, this is part of our gait pattern or the process of walking. With flexion, there's slight tibial internal rotations. So I can't demonstrate that. I can tell you when I flex my knee, the tibia is gonna internally rotate slightly. And as I extend, it's gonna externally rotate because that's what allows us to get in position to put our foot down. And I don't wanna get ahead about gait mechanics, that'll be in 210. But, so we have slight internal rotation with flexion, slight external with extension of the knee. All right, guys. Excuse me. With our ankle, what do we say this is? Dorsiflexion. What is this one? Plantar flexion. And what is this?
Inversion.
Or supination. You think about it, you're trying to pull that palm of the hand, the bottom of the foot up. Eversion, or what?
Pronation.
Pronation. Or pronated foot, you'll hear it that side. And then
Circumduction.
circumduction. All right. Last thing, guys, and you're gonna laugh at yourselves and your partners when you do these, but the mandible, where's your mandible? Right here. What motions do we have there? What's this? Forward. Protraction.
Protraction.
Think of shoulders forward, jaw forward. Protraction. Retraction. Retraction is more of returning from that, because after so far you can't, unless somebody punches you in the face, you can't get your jaw to go back. Elevation, that is just, and then depression is the lowering. That's part of the chewing process, elevation, depression, okay? So there's the basic movements that you guys need to know, okay? I want you to take a little bit here and practice